So we have had a lot of questions about the Veterans Affairs. So if a patient was diagnosed at a VA institution and was referred to your facility for treatment, please exclude the patient. Also, if a patient has received follow-up care at a VA institution, please exclude the patient. And you can do this by selecting no on the Eligibility tab for the question, is there evidence that medical records are available for this patient for 5 years or until distant recurrence or death, and then clicking Submit. So if you find that your patient has had follow-up at any of the VAs, we cannot accept that patient because we won't have any data from them. And that's because of their legal agreement with the NCDB. It was stated in the last webinar that pre-treatment testosterone tests will be accepted on the web form. These pre-treatment tests fall outside of the surveillance period and do not need to be entered. So per the guidelines in the instructions document, only post-treatment testosterone tests are required. If you wanted to add them, you could, but we will not be including that for the analysis. All emails for the special study are being sent from the specialstudy@facs.org email address through an outside server. If you haven't been receiving the emails, send the following information to your IT department and ask them to put us on the whitelist. We've been getting a lot of emails about how they're not receiving the emails. So you have to check with your institution's IT to make sure that they're not getting blocked by firewalls. So we have a lot of different study communications. So on the special study website is the main resource for the study. All emails that we send out will automatically be posted on the website. And same with the Cancer Forum and Standards Resource Library. We'll be posting all the information from the on the Cancer Forum, and then all the webinars will be posted in the Standard Resource Library. We would like you to send all study-related questions to specialstudy@facs.org. So study-related questions sent to personal FACS accounts will be forwarded to the special study address and a ticket will be created. So either send an email through the contact form of the website or email the specialstudy@facs.org email address. Please do not send both, as all emails go to the same account. Only registrars and co-op registrars will have access to the web form. If an error message appears during login, please try using a lowercase instead of capitals for the password. If you're unable to log in to the web form using the same username and password as DataLink, please try using a different browser like Google Chrome or Firefox. We also would like, if you still are having problems and you want to email us, we would really like you to mention your PIN number, and that will help us better assist you in all emails. And also Google Chrome is the preferred browser for the study. And so in case people have viewing issues and they're not seeing the full screen, we'd like you to use Google Chrome. It will still work on the other browsers, but we just prefer Google Chrome. Based on the COC guidelines, data collection must be completed by a certified tumor registrars. This follows the requirements set forth by Standard 5.1 Cancer Registrar Credentials. Case abstracting is performed by a CTR, and non-credentialed staff who are abstracting and who are in the 3-year grace period are supervised by a CTR. For integrated network cancer programs, data will need to be submitted at the individual facility level, not through the network PIN. Registrars and co-registrars need to be given access to each individual facility's data. Please contact us if you think you need access to specific facilities within your network. So now we're going to review the questions that we received after the webinar last week. So what records need to be collected? So we are asking for all patient medical records are required. All records relevant to the patient's monitoring during surveillance, including empty office and hospital records. So this includes the urologist, PCP, and the radiation oncologist if the patient received radiation at any time. This may require traveling to outside institutions for follow-up information. Patients must have a primary care physician to be eligible. PCPs commonly check PSAs, and that is the most important part of the study. This is also very important for data completeness. What should you do if a physician's office does not respond to record requests? If the record request form was faxed, we would like you to call the office directly to request the records. Make sure to send the letter template for patient information from the COC so the office is aware this data is required for COC accreditation. We have posted the letter templates on the website, and you can use those letters directly, or you can just call the offices. So you don't have to use the letters, but they're just there for reference. So do patients need to sign a medical record release form? Patients do not need to sign a medical records release form for the special study. The PI has received an IRB exemption at his facility. The Commission on Cancer does not require participating facilities to receive IRB approval for this study. Instructions have been sent to the address for the hospital registrar identified in data link. One instructions document per facility was sent via U.S. Postal Service mail. An electronic version of the instructions document can be accessed via the web form and the special study website and the cancer forum. The electronic version and the hard copy of the instructions are identical. So we've been asked what the rationale for the surveillance period is, and so we need to determine whether surveillance frequency is associated with survival of patients. It is necessary to have enough follow-up for survival outcomes. It's important to have 8 years of records because prostate cancer is a slowly progressing disease. Most patients do not develop a recurrence or die from prostate cancer for many years. So questions about the webinars were that we are offering NCRA CE certificate CE credit, and the certificate templates are posted on the special study website. These webinars cannot count towards Category A credit. All webinars will be weekly on Tuesdays at 11 a.m. Central Time for the entirety of the study. And that will be until July 17th is the deadline. So you would need to register each week using the same link, and some people get individual email confirmations, but those are not needed to participate in the webinars. As long as you register, you should be able to participate in the webinars. So questions about PSA and biochemical recurrence. So PSA is not recurrence for the registry. It is biochemical recurrence. However, we can't document until metastasis. The web form will collect each date of PSA test and the result of the PSA. In the data analysis, we will use PSA results and the date of the test to determine the date of the biochemical recurrence. Can you clarify how to define and code biochemical recurrence? Based on the rising PSA post-prostatectomy as it relates to this study and general documentation for follow-up. On the web form, we asked for the date of each PSA test and the results. So in the data analysis, these dates will be used directly to determine the follow-up frequency. So treatment questions, are you looking at first surgery, first radiation done at our facility only? Yes, this has been done behind the scenes. Does radiation treatment include proton beam therapy? Yes, radiation does include proton beam therapy. Neoadjuvant androgen deprivation therapy, ADT, causes the case to be excluded if they went on to receive surgery or external beam radiation. So if a patient received neoadjuvant ADT followed by either surgery or radiation, then the neoadjuvant ADT doesn't count. The patient is eligible and primary treatment is the surgery or radiation, whichever is first. And this is defined more clearly in the instructions document on page 3. So if And then, so now that's the end of the PowerPoint. If we have any more questions, please post on the question part of the webinar. You will not have sound, so this is just the best way to answer all your questions. So I will start reading the questions that have been answered. Will these meetings be every Tuesday at the same time for the duration of the study? Yes, they will all be on Tuesdays at 11 a.m. Central Standard Time. And you will get CE credits for every week attended. The amount of CE credit will be different, so we will let you know how the CE will be given. And I will also post the CE credits numbers on the website as the title, so to avoid any confusion. So if the prior webinar recommended selecting all 12 patients before beginning the actual abstraction process. If your initial and cursory review deemed the patient eligible, but after you get going on the data collection, you realize the patient should in fact have been ineligible, you can go back and change the answers to the eligibility questions, making them ineligible, and requesting a replacement patient. So if you find that during data collection that the patient is ineligible, you won't be able to make the eligibility question, change the eligibility question, so you'll have to just email the special study email address and request a new patient, because once the patient is eligible, then and you move on and start entering more data, then you can't go back and change it. So you'll just have to email us. So the certificates for credit, like the previous special study, will be posted on the ACS special study website. You will have to fill in the information about your name and the number. So we've already posted the template, and you can use that for all of the webinars.
Hey, Eileen, this is Ron Chen.
Hi.
Hi. First of all, I just wanted to chime in and thank everybody for your efforts on this special study. I think this is a very important effort. I think it will help the NCDB. I think it will help also impact the care of prostate cancer survivors. There is a question that was typed that I wanted to answer verbally, and just want to clarify an issue. And the issue relates to whether a patient must have primary care physician to be eligible for this study. And so it would be a long type response, so I thought I would answer verbally. So first, when you start looking at a patient, there's some of the screening questions for eligibility. Those are the only screening questions. And so if a patient meets those screening questions, they're eligible. Now, the issue about primary care physicians is a very important one. We, for this special study, we're asking you all to collect records from the primary care physician, because what we really need to know is we need to capture every PSA that has been collected by any physician. And so even though some patients may only get follow-up primarily through the urologist's office, if we don't collect records from the primary care, and primary care doctors often get PSAs, if we don't get records from the primary care's office, we will be missing the PSA information from the primary care office, and then we won't be able to assess the frequency of surveillance, the results of the PSAs. So it is very important, even though a patient may primarily get follow-up from the urologist's office, it is important to collect records from the primary care physician's office as well. Thank you.
Okay, so we can go back to some of the questions. Will you get an email confirmation that you attended these webinars with the NCRA number for CE credit? No, we will not provide email confirmation. You'll be required to track attendance and will be able to fill out the certificates yourself with the program recognition number. So patients diagnosed from 2005 to 2007 are eligible. For some facilities with insufficient number of cases, patients diagnosed in 2008 are added. We have posted the webinar last week on our website for the special study. In case you missed it, you'll be able to rewatch it. And then you would also need the YouTube capability. If you have not received the official mailing of the instructions document yet, you should have received it by now, so you can just email special study and we can confirm the address that was in data links with you. We hope that the document will arrive this week, but if it doesn't, you might need to just print the instructions, print the electronic version. So if you are not able to find necessary data for some patients for the eligibility screening questions, then replacement patients will be necessary. So if your reference year is after January 1st, 2009, you will not have eligible cases. So if somebody's reference year is 2000, they would not have any patients because we're only selecting patients from 2005 to 2007 and then a couple from 2008. We will update the NCRA credit to be able to make it able to update the field.
Hey, Eileen, this is Ron Chen. There are several questions with the theme of what happens if the physician offices don't respond to requests. I know you addressed that a little bit earlier, but maybe just repeat that because there are several registrars asking that question.
Oh, I'm sorry. So if you have a reference year of 2000, you do have cases. It was after 2009. Sorry about that. So 8 years of PSA is required. So for eligible patients, we request that registrars collect 8 years of data and then stop.
Eileen, can you go back a couple slides to where you talked about the follow-up in facilities not getting back to you yet? And kind of go through that again. I think people have come on a little bit late, and it might be helpful to go through the questions that have come through again.
Okay, so is this the slide you're talking about?
Oh, yeah, sure.
Okay, so we are requesting the patient medical records to be required for the data collection for the study. All records relevant to the patient's monitoring during surveillance, including the doctor's office and hospital records. This can be a urologist, primary care, and radiation oncologist if the patient received radiation at any time. So patients must have a primary care physician to be eligible. Primary cares commonly check PSA, and it's important for data completeness. So this may require traveling to outside institutions for follow-up information.
Eileen, how about next slide?
Okay.
There you go.
If a physician's office does not respond to record requests, if you had faxed the letters that we provided, then we would suggest that you call the office directly to request the record. We also want to make sure that you send the letter template for the patient information from the COC, so the office is aware that the data is required for COC accreditation.
But I think to follow up on this, if there are patients for whom the record just cannot be obtained, and I think there's some themes here, whether the physician's offices just don't respond despite several requests, or I don't know if the physicians have retired, which is what some of the questions are related to. Physicians retiring just cannot get the records. I think the theme of if you try, and just not able to get the data for some of the patients, I think the last possibility would be to ask for a replacement patient. It is important for us to have complete data for this special study, and so if there's absolutely no way to get data on some of the patients, then we'll have to have a replacement.
So the special study is not through the American Urologic Association. It is through the COC and NCDB, and is a similar collecting to the follow-up data for all NCDB patients. So we will post a copy of today's PowerPoint on the website, as well as a recording of the webinar. It might not go up today, but at least by tomorrow. So the list of patients for your facility should be listed in the web form under data links. The first webinar is posted on the Cancer Forum and the Special Study website. So in order to access your list of cases, you need to log into data links and go to the home page and find the link for the special study, and that will only be available to those listed as hospital registrar or co-registrar. And once you click on the link, then you can use your same login to access the special study. And we have been getting some people getting invalid errors on the login screen. So if you have capital letters in your password, we would like you to make those lowercase, and then everything should work out. If you're having any viewing issues, we suggest trying Google Chrome browser. The PSA tests do not have to be entered into the web form in order. If you find that the RADONC listed out the PSA for a few years, then it's fine to put those according to the RADONC notes. They don't have to be in chronological order in the web form. We also would like you to get notes from urology and primary care to see if they have checked additional PSAs. The deadline for the study is July 17th. So you should be receiving emails from Special Study at FAQs.org with study updates. An email was sent out yesterday at 11:45, and if you're not receiving emails, please contact your IT department. So if the first PSA following surgery is more than 2 years after surgery but is below detectable limits, is the patient eligible for inclusion or are they excluded due to the time lapse? We need to know the frequency that PSAs are checked. If a patient's very first PSA checked is more than 2 years after treatment, then this patient is not eligible. So if a patient was seen for 4 years and then stopped coming to your facility, does this mean that the patient is not eligible for the study? No, they would still be eligible, and we would like you to see and check other offices to see if they had follow-up at other institutions. So if you see 5 years of follow-up and then 8 years of medical record, we are asking that there's a minimum of 5 years to be eligible for the study, and then we ask that you collect data for 8 years and then stop. I'm going to go to the slide with the IT issues. So if you're having problems receiving the emails, then I've posted the whitelist for the IP address. I'm going to go repeat the VA slide. So if a patient was diagnosed at a VA institution and was referred to your facility for treatment, then please exclude the patient. And also if they had received follow-up care at a VA institution, you would need to exclude the patient. This would be done by just clicking no for eligibility, or is there evidence that medical records are available for this patient for 5 years? So if they had any follow-up at a VA institution, then we are just considering that that they don't have enough follow-up information because we won't be able to have access to that data. I will go to the communication slide so everyone can copy down the website. So if you have any specific questions, we would like you to email specialstudy@facs.org, and please include your PIN number so we will know which site you're talking about. Some people will have less than 12 patients. We have already done an eligibility inclusion-exclusion criteria behind the scenes. So if you have less than 12 patients, just enter what is in there. If you don't have the link to the special study on your data links homepage, then you might not be listed as the hospital registrar or co-registrar. So we've only given that link to the people with that role in data link. If your urologist is managing the PSA for 8 years and not the PCP, that is fine, but we would like you to collect records from the PCP to make sure that no PSA was checked from that office as well. So we do want the PSA results for each year. So we are asking that you collect all PSAs performed during the surveillance period. If you have 6 years of data but not 8, we would like you to replace that patient. However, if you find that within the 6 years the patient had distant recurrence or death, then they would still be included. It's either 8 years, distant recurrence, or death, whichever comes first.
I'm sorry. So I think the question is so the eligibility screening question says that each patient has to have 5 years of data to be eligible. So if a patient has 6 years of data, which is more than 5, that patient is eligible based on the screening question.
Right. So the 12 cases that are assigned should be checked first for eligibility before starting to collect data, and that's what we're suggesting. So in case you have to go to outside institutions, you won't have to make more than one trip. If you only have 3 patients and have to exclude one, then another one will not be selected. You only have a replacement patient if you have more than 12 patients. Each site will collect up to 12 patients total, and we have selected patients at the NCDB. If you do not have 12 patients, you still want to complete the study with the number of patients that you have. So the question is the study mandated for all registries? Yes, the study is required for all eligible COC accredited institutions to fulfill standard 5.7. The last webinar and today's webinar were worth 1 CE credit. So, and I will post the numbers on the website in the titles from now on. So if you only see 2 eligible cases data links, then that is the only amount of patients that you have at your site.
So Eileen, if I can chime in real quick, this is Ron Chen. There are some questions related to eligibility of patients. And so just to be very clear, the 3 screening questions determine if a patient is eligible. So one of the screening questions that you see on the screen is, on your web form, is there evidence that medical records are available for 5 years for this patient? The second screening question is, can you figure out who the physicians are? Can you figure out primary care, urologist, radiation oncologist? And the third screening question is, did the patient have at least 1 PSA within 2 years of treatment? These 3 screening questions determine eligibility. And so if the patient meets these 3 questions, they're eligible. And so the screening question here is we have to have at least 5 years of records on the patient. So, you know, if we determine the patient is eligible based on this screen, and you know the patient dies at year 6 and does not have 8 years of data, that patient is eligible. And so I want to clarify that as long as patients clear these 3 screening questions, they could be included for the study.
So if you have a reference date in 2006 or 7, we will definitely take your cases in 2006 and 2007. And then if you have less than 12 in those years, then we will go into the 2008 years. So we primarily want the 2005 to 2007 cases, and then if there aren't enough at your institution, then they will go into the 2008.
I think there are a few questions related to if a patient is not eligible and a replacement is necessary, how fast do the replacement cases come? Can you or Zahed or Amanda comment on that?
It should be within 48 hours. But I would probably check with the head on that one. So about the deadline is July 17th. We are giving 3 months for data collection on 12 patients. We have extended the time frame due to feedback from the last study, which was looking at 30 patients in a shorter time frame. So we hope 12 weeks will be enough time for data collection for 12 patients.
Eileen, I think Zahed is on mute, but the patient replacement is actually instantaneous. So all the questions that have come through about patient replacement, you won't have to wait. It will just automatically show up in your patient list, the new patient.
Oh, okay. So the mailed instructions will have the registrar's name in the address. So we sent it to the main hospital registrar listed in data link. So that their name should be on there, not just the cancer registry. So Ron, there's a question about if the patient expires 3 years after diagnosis, not 5 years of medical records, would the patient be eligible?
Yeah, so the exact wording of the screening question is there evidence that medical records are available for this patient for 5 years or until distant recurrence or death? And so we do include death as a possibility, and the sequencing of this is defined pretty clearly in the instructions. So I think if a patient doesn't have 5 years of records, but they died before that and they had complete follow-up until death, the patient is eligible. And I think that the instructions hopefully are pretty clear on that.
So Veterans Affairs are not eligible for the study because of legal agreements that they have with NCDB that they do not share data for the special study. So we wouldn't be able to get their records. So comparing the info that the NCDB has for a patient to what you have in the EMR, you should have more information available in the EMR than what's in the NCDB, especially about the Gleason for the prostatectomy scores. So if you look at the note in the instructions document that the prostatectomy Gleason scores were not abstracted until 2010, so we are asking that you add the prostatectomy Gleason scores in there because your patients wouldn't have that since they would be diagnosed before 2010. It wasn't required back in 2005, so we're asking you to enter the Gleason scores now. We have created a form that you can send out to outside medical offices for information, and they can be found on the special study website, which is on the screen right now. The NCRA program recognition number will be different for each webinar. So from now on, I will just post the title on the website as the NCRA number. If anyone's having problems logging in, then try using lowercase letters instead of uppercase letters for your password. Yes, we do want 5 consecutive years of follow-up. So exactly as the eligibility questions say, answer the questions how they are written. So for the number of years patient records are required to be kept by physicians, this is set by individual state law, which can be 10 years. So we would like you to email specialstudy@facts.org if this is a problem, if you don't think you can find 12 patients that you have all the records for. We did not include the letter to physicians in the instructions document. You can print it off of the website. Not having a PCP does make the patient ineligible.
I'm sorry, Eileen, can you repeat that?
So not having a PCP means the patient is ineligible.
So I'm sorry. So we request that the registrars get records from the PCP, I think that there will be a small number of patients across the country who just don't have a primary care doctor. And if you are absolutely sure that the patient has no primary care doctor, then the patient is eligible. They can be included. But if the patient has a primary care doctor, then we request that you get records from the primary care doctors, because if we don't ask for their offices for their records, then we don't know about the PSAs they've checked. And so we cannot assume that urologist checks all the PSAs. We have to get records from the primary care doctor's office if the patient has a primary care doctor. But for the very small number of patients who just don't have a primary care doctor, then they can be eligible.
No, the patient does not have to die from prostate cancer. So if you have a patient who was seen in 2006 and no records are available until 2014, you should definitely check with radiation oncologist, urologist, and PCP before saying the patient is ineligible. We would like you to check outside institutions to make sure that so you can have the complete set of data. The PowerPoint presentations can be found on the website along with the webinars. If you have PSAs from the urologist for all the 8 years, you would still need to contact the PCP to make sure that they also did not do any PSA tests. So we only want you to reject the patients if they do not meet the 3 screening questions. Once those 3 screening questions, if one of them is selected no, then they will automatically be replaced. If you continue to, if you mark a patient as eligible and then move on to collect data and enter data for the other tabs, then you will have to email us to request a new patient. But if you initially mark the patient as ineligible, the replacement will be automatic. If you do not have patients listed, we would like you to email us with your FIN to just make sure that you don't have any eligible patients. It could be a system error, or you could just have, you might not have eligible patients for the study. The webinars are not required, but they are suggested, and we will post updates and announcements on the slide. So if you would like to expand the number of data links users to have more than 3 CPRs, then you can do that during the special study, but please email us and let us know so they don't kick you out on the data link side. And this will only be available during the study period. So both webinars that we've had so far are worth 1 CE hour. So we will post all the webinars on the special study website and the Cancer Forum Standards Resource Library, and they should take 24 hours to be posted. I think that's all the time we have for today. If anyone has more questions, they can email us, and we will see you next week. So thanks for calling in.